Hi, I'm Dr. Stephanie Sjoblad, and I'm the clinic director here at the UNC Hearing and Communication Center, and I'm also an audiologist on the team. My background is, I have a business degree first and foremost, and because of my own personal experiences with hearing loss, growing up with hearing loss and wearing hearing aids from a very young age, I became interested in the field, and I eventually went back to school. I have been on the faculty here at UNC for over 20 years, and I was a person who was responsible with helping to establish this community-based clinic back in 2004. It's always been a training program, which we're very proud of, for a nationally ranked audiology program to have such an excellent clinical facility. Well, my general role is I'm in charge of overall management of the clinic, but the most passionate part of my job is when I get to actually work with patients and supervise students in the clinic. I enjoy helping people to make those communication connections that they've started to miss because of hearing loss. And as someone who's had hearing loss, I have a deep understanding of what that feels like. So I think that helps me to make a good connection with my patients and help them solve their problems. You hear the word holistic, which is, I think, a way to describe not just being so focused on the procedures, but getting to know the person. And I encourage my students to get to know the patient beyond just what they're coming into the room for, because those are the things that they're trying to solve, is how to be the father they used to be, the mom they used to be, the grandmother they used to be. And their hearing loss has prevented them from staying as connected as they'd like to. So we really take an approach of looking at the person and trying to help them open up about the things they wish they could do, the things they're struggling with, and set some goals, and be sure we revisit those goals at the end of the process to ensure that we've actually done our job. And I would say 99% of the time, patients will report at the end of the process that it is so much better than when they walked in the door. I was born with hearing loss. I was not identified until I was 6 years of age. So I started to wear a hearing aid in the first grade, little body hearing aid with a cord that came up. I did my best to hide it. I had a little harness that I wore underneath my clothing, and I wore my hair long so that the cord would be hidden by my hair. Eventually, I was able to get a smaller, and by smaller, I mean maybe this big, unit that went behind my ear when I was in the 4th grade. I was pretty happy when that came out. So the hearing aids today are beautiful. They're microscopic, they match your hair. What I had to wear when I was a kid, not so much. I think that hearing is far more important than people have ever been led to believe. Hearing is what keeps you in touch with people. It's the center of how you communicate and stay connected to the world. But additionally, untreated hearing loss is tied to several major health ailments. There's an increased risk of hospitalizations if you have untreated hearing loss, an increased risk of falls for people with untreated hearing loss, increased risk of heart disease. The list goes on and on. Almost every system in the body has the connection to untreated hearing loss. And then the one that people know a lot more about recently is there is a connection between hearing loss and cognitive decline. We don't quite know what that connection is, but most of us want to stay in touch with the people we're around. So treating your hearing is really a pretty vital thing to do. I hope you'll think about coming down to the UNC Hearing and Communication Center and letting us help you stay connected to the world.